Okay, so today I was dispatched to a 20-year-old male patient that has his left hand caught in a meat grinder. He is conscious and he is breathing. So before I get there, I'm going to have my appropriate BSI, which would be gloves, safety glasses, gown, and a mask. So the scene size up, I'm going to make sure the scene is safe, make sure nothing's going to fall on me or there's nobody that's going to hurt me. So the mechanism of injury in this case would be the meat grinder and his hand is caught in there. I'm going to determine the number of patients, which is only one, and for additional help I'm going to call the fire department to detach the industrial meat grinder, and I'm going to call for ALS. I don't see any need for any C-spine precautions right now. So I'm going to start the initial assessment. The general impression of the patient is unstable. He is bleeding. I'm going to determine his level of consciousness. So I'm going to ask him how he's feeling. How are you feeling, sir?
Not very good.
Okay, so he is talking to me. So he is alert. He is conscious. He is breathing. His chief complaint is that he has his hand caught in a meat grinder. I'm going to address any life threats, which he is bleeding out of his left hand pretty bad. His airway, he's talking to me, so he does have an airway and he is breathing, but I am going to put a non-rebreather on at 15 liters. I'm going to assess the circulation in the hand that's not caught in the meat grinder. He has a faint pulse, but he does have circulation. So now at this time I'm going to control any kind of bleeding that's going on. So I'm going to put a tourniquet above the spot that's caught in the meat grinder to stop the bleeding from going on. I'm going to assess his skin. It's pasty white, cold, diaphoretic, and the patient is high priority, and it's a load and go. I decided to do a focus history and physical exam while the fire department is detaching the industrial meat grinder. So I'm going to start with the sample history. So signs and symptoms that I can tell is that his arm is bleeding and his hand is caught in the meat grinder. I'm going to ask him if he has any allergies. Do you have any allergies, sir?
No, sir.
Take any medications?
No, sir.
What kind of medical history do you have?
Nothing bad.
Nothing? Okay. When was the last oral intake?
This morning.
What were you doing before you got your hand caught in the meat grinder?
Trying to grab some meat, fish, and sausage.
Right. Okay. So now I'm gonna put him in the ambulance. The fire department has detached it, but it's still on his hand, so he's just in the ambulance with the meat grinder, so you can lay down now. Okay, so I'm going to be looking for decap BTLS on the patient. So I'm going to be looking for deformities, contusions, abrasions, punctures, burns, tenderness, and laceration, swelling. So first I'm going to assess the head for raccoon eyes or any kind of discoloration behind the ears. I'm going to make sure there's no fluids draining out of his ears, his nose, his mouth. His airway is patent. I'm going to look at his neck for JVD, any kind of tracheal deviation. I'm going to listen to the lungs, make sure he has both lung sounds. I'm going to look at equal chest rise and fall. I'm going to go down to the abdomen, make sure everything is good down there. Make sure he doesn't have any rebound tenderness going on down there. So I'm gonna look at his extremities. What I'm also gonna do is pelvis. I'm gonna make sure everything's stable in his pelvis. I'm gonna check his extremities, cap refill, and I'm also gonna make sure he can move. Can you push down? Push down. Okay. He does have circulation. His cap refill is good down here. I'm going to palpate his leg, make sure there's nothing abnormal. I'm going to go back up to his arms. I'm going to look at his arms. I'm going to check his pulse in this hand, his circulation. Everything's good. I'm going to check his DCAT, BTLS in this hand. His other hand, I'm going to make sure the tourniquet has stopped the bleeding and is still stopping the bleeding. I'm going to take another set of vitals right now, and I'm going to compare it to the last ones. And I'll do a radio report to the hospital and get him to the hospital.